deal with routinely. So that's really was the logic.
Um, and you've mentioned that long COVID isn't just one condition. Can you speak more about that?
Well, yeah, I mean, first of all, let's talk about how do you know you have long COVID, right? That's, I think, the first question is how do you diagnose it? And, like all diagnoses, the criteria will change over time, but basically it's you're correlating the infection or the vaccine with a change in your medical condition, right? And that should be at least for 3 months. And sometimes it's relapsing, sometimes remitting, and sometimes progressive. And it affects lots of symptoms. The main symptoms that people have are fatigue. They have, like chronic fatigue, they have trouble after they exercise, they're exhausted, they get brain fog, they have shortness of breath, which is different than chronic fatigue syndrome. You'll have shortness of breath, palpitations, dizziness on standing. You can stand up and feel horrible because your blood pressure drops and your heart rate goes up. That's called POTS, postural orthostatic tachycardia. And you can have gastrointestinal symptoms. You have changes in your smell, your taste, dizziness, sleep disturbances. These are the common symptoms that you have.
So let me just pause you there because you mentioned after exercise, but these symptoms aren't just after exercise,
Right. But what
right? You can
happens?
just have shortness of breath. You could just have problems with your blood pressure when you go to stand up
Correct. That's
without having exercised.
That's correct.
Hmm.
So one of the things we do is a passive standing test. We have people stand up, lie down for a while. We'll do it in the morning after you're sleeping. Take your blood pressure, your pulse, then stand in place for 10 minutes and check your blood pressure every 2, 3 minutes and your heart rate every 2, 3 minutes, and also note how you feel. And you'll see a big rise in the heart rate and a drop in the blood pressure. Why that happens? It's probably the immune system attacking the small nerve fibers and the blood vessels and the parts of the brain that control blood pressure and heart rate. And that's probably what it is. So let me actually back up and talk about the core issue. Really, the core issue in long COVID is that usually it's for people who've been vaccinated. I routinely measure the antibodies against spike protein. So let's talk a little bit so we make sure that people understand. The COVID virus, think of it like a ping pong ball, and imagine a ping pong ball that has spikes sticking out of it. And the spikes are what actually dock or attach to the cells in your lungs or other cells in your body. And it's through those spikes that the virus can attach and inject parts of itself into the cell, and then kind of hijack the machinery and produce more spike proteins.
So the spike punctures other cells. Is that,
Yeah, or it could
I
puncture
don't know.
maybe a tube that allows, the viral RNA to go into the other cell and then build another virus in the cell, right? So that's kind of what happens. Now, the idea in the vaccine is, well, if we give you a vaccine that has the spike protein sequence, the amino acids, the building blocks, the Lego shape of the spike protein, we put that into your muscle and we inject it, then your body will say, oh, foreign protein, spike protein, let's make antibodies against it. And then if you're exposed to the virus, you'll already have antibodies and you won't get sick.
You've trained your body. You've trained your immune system.
Yeah, the vaccine trained your immune system to create a police force against invading virus, right?
Hmm.
That's the theory.
Mm.
Now, it turns out it actually doesn't stop you from getting sick. It may stop you the first time you get it from getting more severely ill or being in the hospital, possibly. But with further uh, vaccines, you actually increase your risk. But anyway, so now your body's making this police force, these antibodies against COVID spike protein. Well, the problem is that the sequence of amino acids or the shape of the Lego spike protein, whatever you want to call it, is the same shape as certain proteins in 28 different tissues in your body. So not only are you making these antibodies that will attack the spike protein, they're also going to attack your own tissues. So you've actually created an autoimmune disease. These tissues can be in the brain, they can be in the kidneys, they can be in the heart, in the blood vessels, in the GI tract, in the reproductive organs, etc. Right? So that's the problem. Now, does everyone get an autoimmune disease in all of these tissues? No. It depends on your genetics, most likely, and maybe some other factors. But certainly, this is the case, and this is likely responsible for a significant portion of long COVID. So
Can you recap that? So you said, as I understood, getting the vaccine initially probably reduces your symptoms and maybe keeps you out of the hospital.
right.
But with subsequent vaccines, you're maybe
Yeah. With your
creating,
boosters, you actually have a worse reaction.
and that's because you're creating too many
You're
policemen.
getting more of an inflammatory reaction, right? Because you're now kind of sensitized and you get in a way, almost like I mean, it's not really an allergic reaction, but it's almost like that. You know, you've been sensitized and you will react more strongly. And that reaction can be devastating, could even be fatal. Also, there are downsides to getting the vaccine. We see a lot of athletes, younger athletes they're dying, from myocarditis, cardiovascular problems, et cetera. Lots of problems, right? So that's the main issue here with long COVID. Now, you had
Is
a
that is that with all the COVID vaccines?
yeah, yeah.
Yeah. Okay.
Now, it was mostly with Pfizer, Moderna. The other one was, I think, was Johnson and Johnson. I think it was a different thing. It may not be the case, but I don't think I've ever had a patient who got that third vaccine. So I can't really say that, but with Moderna and Pfizer for sure, that's the case. Now, um, at this point, we've been measuring the spike protein antibodies in people's blood, probably 2.5, 3 years. Anyone who's had a vaccination has spike protein antibodies very high level. The normal is under 0.8. Anyone who's got COVID without the vaccine, I've never seen it higher than 900, which is pretty high, but it's not 25,000, which is we see 10,000, 14, 15, 25, over 25,000 in people who've had the vaccination. The antibody levels are much, much, much higher.
Mm.
They degrade. It looks like the body kind of is slowly getting rid of these spike protein antibodies, but I don't have anyone who's yet come down to zero without any treatment. It seems like it's a very slow degradation. I'm going to say somewhere maybe like 5% a month or something like that, And I don't know what it'll be like after 3 years. Will it remain at a low level? Will it go away? We don't know yet.
So do the number of spike proteins somebody has determine whether they get long COVID or not?
No, I don't think so. That's a great question. It really has to do with how your immune system responds to it and which tissues are affected by these antibodies, right? So if I have certain genetics that cross-react with these antibodies in my heart, I'll probably get myocarditis, inflammation of the heart, right? If I have it in my kidney, maybe I'll have some kind of kidney problem, right? If I have it in my lungs, I might have a chronic cough. If I have it in my brain, in other words, if it cross-reacts with tissue in this Lego spike protein shape that my brain already has, it cross reacts with that, then I might actually be tipped into dementia or Parkinson's. We have people who are tipped into Parkinson's disease, for example, or you might have trouble with smell. So it just depends where. I mean, in the brain, it tends to attack the deeper structures in the brain, more on the base here of the skull. So the smell here, and then the deeper structures like the brainstem, pons and medulla, so it can affect your sleep and your mood and etc. So
So, so, you mentioned so many different symptoms that people can have. How would somebody know if they have one, two, three of these symptoms that they have long COVID and it's not just some other medical issue?
well, so this is where we do things, say, much more thoroughly than others do. So we look at, I've been doing functional medicine now for probably 35 years, maybe a little longer, right? So I know, um, I'm used to looking at the nutrition, at the digestion, at the hormones, at the inflammatory system. I'm used to looking at the brain, the cardiovascular system. So we look at all of these things all the time, and I've been doing it for a long time, right? So I'm looking for not just long COVID, but I'm looking for, well, are there other problems that are going on? Usually the long COVID unlocks other things. It's a stress on the body. So it may activate other problems that you didn't even have before. Maybe you were genetically vulnerable, you may be on the edge, but it can actually activate those things, right? So this one guy with Parkinson's, well, he didn't have really much Parkinson's symptoms, and he doesn't even have a family history, really. And but after the vaccination, he developed Parkinson's. So did he have some vulnerabilities, and then this kind of kicked him over the edge. So you have to basically, you look at the long COVID and you say, okay, we have the spike proteins, we have the symptoms. We try to remove the spike proteins, and we also are looking at all the hormones. Well, how are the hormones doing? Do we need to fix the hormones? Do we need, oh, wow, is there some other infection that we have to treat? This guy with the Parkinson's had a strep infection. He had an abscess in his mouth. And that was going on long before, probably long before the COVID, right? So we look and we say, oh, wow, this is actually a layer cake or layers of problems. COVID was the last thing or so. That's typically what it is. That's typically what it is. Now, if you're the athlete who's 25 and you get a heart attack, you probably didn't have a long list of other conditions, unless you were using drugs or something like that, but probably you didn't. It just affected your myocardium or the conduction system in your heart, and you had a heart attack, or something like that, or blood clots or something like that. So usually in older people, there are layers of problems, and the long COVID is part of that picture. When you address all of these, you identify them, address them, then people get better. Now, then we also have another technique or technology that we use aside from this functional medicine approach, and we also look inside the brain using two technologies. One is a neuroquant MRI. It's an MRI you do in a hospital that looks at the structure of different parts of the brain. And we also do a quantitative EEG where we can actually see how the brain is functioning. In all of the brain, we can see all the different tracks. We can see the surface of the brain. We can see so much detail. And so when we do that, we can actually see where we have to target. And we can target this with basically brain exercises, neurofeedback, or a QEEG guided light that will actually treat the brain, reduce inflammation in the brain, give the brain energy, et cetera, and actually heal the brain. Sometimes we use hyperbaric oxygen, not always. So we have lots and lots and lots of tools, and it's just about kind of parsing out, where people need the help.
And have you had people who have long COVID get better?
Yes, yes, yes. Yes, we have that people, for example, with POTS, who, they stand up and their blood pressure drops, their heart rate goes up, they can't exercise, for example. And that's based on, as I said, probably small fiber neuropathy, meaning the COVID spike protein antibodies are cross-reacting with the small fibers in your blood vessels and that control the tone that helps you maintain your blood pressure. Those are being attacked by the COVID spike protein antibodies. We've actually reversed that. That usually goes away when we treat it. It goes away. Could take a while. It could take a year. Take
A
9 months.
Yeah.
9 months. It depends. A lot of it depends on the patient's ability to do what they have to do. But there is a time. It's not going to go away in a month.
Hmm.
But it does improve pretty routinely, really.
Um, I don't know. Let's see if people have any questions, or you have other things that you want to touch on.
Um, I think the main thing I would say is it's treatable, and the treatment takes some time, but we can short circuit the treatment with when it's appropriate with laser, which is basically a high intensity light that is applied to different parts of the brain depending on where we need to target, and sometimes neurofeedback. And so you don't have to wait the 9 months or the year and a half to feel cognitively better. And then we also look at genetics. So, for example, this is an inflammatory problem, meaning the body is constantly making cytokines which attack, you know, try to create, some kind of response to this thing, and the immune system is activated, and we can actually help by looking at your genetics. We can actually look at, are there areas in your genetics that make you vulnerable to this inflammatory condition, and we can actually work with that. So there's a lot of ways in. It's not. I wish it was like, well, here's the pill, boom, you're done. That'd be great. But unfortunately it's a disease that involves many different tissues in different people. It's different. The underlying pathology is the same. The comorbid or the things that occur with it are different in other people. Some people it brings out Lyme or Bartonella, et cetera. Sometimes it brings out a arrhythmia in the heart. Sometimes brings out lung disease, et cetera.
And do people with long COVID typically have high spike protein levels?
Oh yeah, yeah, yeah. And we watch those and we follow them. We bring them down. We use some various supplements to try and bring them down, and it works. It varies with person, but it's a combination of all these things, really.
So you're treating different metabolic systems as needed,
Yes,
basically.
yes.
Yeah.
And let me say this, you have it, you're going to have to change your lifestyle, and that means eating good, making sure you get enough sleep, right? When you're ready, gradually moving into some exercise when you're ready. There are things you might have to do that, maybe you're 20 or 25 and you say, well, I didn't have to do all this, why do I have to do this? You
Mm.
know, and but it's a disease and it needs to be treated, and that's part of what you have to do. You want to be in a lower stress environment, you know, but you can you can get better. You can get better.
Are there medications that are involved in the protocol? Or I guess because everybody's different and it depends upon which systems are problematic.
Yeah, I mean, sometimes there's medications. For example, if someone's having a problem, you could use medication. Let's say they stand up and their heart rate goes to 180.
Hmm.
Well, how do you tolerate that? So you might have to use a beta blocker in order to stop that, right? So the person can at least function. And over time, you can get rid of it. You use a beta blocker that doesn't go into the brain so that you don't get depression as a side effect, right? So, but there are lots of medicines. I would say we're not that heavy on the medicines, really. If we need to use them, we do.
So what would you say? What are the things that people really need to know about long COVID that they don't know, or they have, erroneous information or assumptions about long COVID?
Well, I don't know how much people really know.
Mm,
I think that people need to understand that it's um, let's say, a full body disorder,
mm.
not in your head, in your mind. It's not, you're not imagining it. It's not psychological. It's very real and it's treatable. Um, but the treatment involves really doing some detective work to see what's involved in your case and then taking action, you know.
And is your sense from, interfacing with colleagues and with patients, is your sense that people think there is a way to treat it or not? What's the common uh,
It's hard for me to
attitude?
say because people are coming to me, right? I'm not surveying
Right.
everybody. My sense is people are kind of resigned to it.
Mm.
My sense is they're kind of resigned to it, and um, it changes their lives. It can change their lives dramatically. And um, uh, but I would say I think people are resigned to it. Yeah.
Is there, say you've had long COVID for a year or two, can you still treat it?
Yes. Yes.
Okay.
For sure.
So there's always hope. It's not
Yeah. Yeah.
inevitable.
And I would say you really need to treat it because you don't really want this thing to go on for a long time. Remember, as I said, it's really an autoimmune problem. So
Mm.
your immune system is attacking, it's been reprogrammed by the vaccine, basically, to attack your body. That's not what they intended. They intended for it to only attack the spike protein, but they didn't really do their work. They didn't really look at what it cross-reacted with, what tissues it cross-reacted with in the body. So you have to treat it because you want to prevent downstream problems in 10 years, in 3 years, in 7 years, in 15 years, right?
Mm.
Important to treat it, very important.
If anybody has any questions, now would be a great time. You can just raise your hand or put it in the chat. And this recording will be up on the wholepsychiatry.com website, probably in the next week or so. And if not,
Okay.
thank you. Thank you very much, Dr. Hedaya. This is,
I'm sorry, I do have a
oh, go
question.
ahead.
I just don't know how to raise my hand.
Oh, go ahead. Go
I'm
ahead.
just trying to type fast. I just want to say thank you, Dr. Hedaya, for your time tonight. I jumped in late, but it was curious to know. I actually have not been vaccinated, but I have been exposed to COVID several times, and I am experiencing long haul symptoms. I actually just spent the weekend in the hospital for cardiovascular symptoms, and of course, they had no answers for me. So, and I'm out of state. I'm in Texas. So, how does the process work? Well, one, are you seeing people, I'm sure you are, with long haul who haven't been vaccinated? And two, if I wanted to work with you, what does that process look like?
So basically, you'd go to the website, fill out a contact form. Oh, there you are. Hi. You fill out a contact form, and you would speak with Dr. Morris after that, and she would kind of answer a lot of your questions. And then if you decided you want to go forward, then we would meet for 15 or 30 minutes on Zoom and see if it makes sense for you and for us, if we're a good fit. And then if we are, then you'd have to actually come here to Texas, you're in Texas. I'll go to Texas. No,
Yeah, at least for the winter. Come on.
actually, I am going
Okay.
to Texas in December, but
Yeah.
Okay. You posted. If it's for professional reasons, I'll come.
yes, yes. So, but you would come for an evaluation, which runs about, depends on the person, 3 to 5 hours I'll spend with you, and then decide, where should we look? What are the tests we should do? Specialty tests, lab core tests, MRI, neuroquant MRI, whatever it is. You'll do a quantitative EEG. And then I'll have a good idea of where to look. We'll do the tests, get the results back. Then we would probably meet on Zoom. And for about an hour and a half, once the tests come back, I would spend about 4 or 5 hours with all the results and say, okay, here's what I think is going on, and here's the plan. And
Hmm.
then put it into a document, and then I would share the document with you, and then we would go over that, and then we would carry it out. Now, being that you're in Texas, the ideal really is for you to do what we call an educational consult. So you would look for a clinician. Where are you? In what town?
I'm outside of Austin.
Okay, perfect. So you would, I'm sure there's a functional medicine clinician who's certified, and basically they would be on the call, the Zoom session
Mhm.
while you're in the office for the evaluation and the report presentation. And then maybe you have also a internist if they feel they need an internist or something. So you have a little team there. I will then say, here's the roadmap, and and then you follow the roadmap. I'm a consultant. Now, if you really looks like you would benefit from the laser treatment, then you'd have to be here, roughly, I'm going to say roughly 4 to 8 weeks. Some people
Okay.
come for 3 months, some people come for 4 weeks. It's everyone's different. That's the kind of wake up the brain, get moving kind of thing. And I think that's kind of how it goes.
Okay. Thank you
Okay.
for that clarification.
Yeah.
And again, thank you for your time and your efforts to find solutions for those of us who are even holistic as I am
Yeah.
suffering.
Yeah. What's your sense, Hannah? Do you know other people with long COVID?
Yes.
Do you feel they've thrown in the towel, or what are they doing?
Not in my community, but I do think that for a lot of people, it's beyond our scope of practice. So, I have a background in holistic health, but also Western medicine as a speech therapist. And it's like I'm trying all these things and it's not really getting to the root, or I'm missing something, is all I can say. And I'm struggling to figure out what I'm missing. So I think I'm actually like meant to go through this so I can, as a practitioner, I have to put my ego and pride aside and ask for help. We don't tend to ask for help. We're the givers, we're the healer. So that's what I'm here for. And I think in some ways that's part of my journey and my lesson is to show other people that it's okay to ask for help and receive. Um, yeah,
That's very good. Well, you got a great attitude, and I wish you help and healing and speedy recovery.
thank you. Thank you. I'll be in touch with you all.
All
Yeah.
right. Take care.
Okay. Have
Thank
a great evening. Thank
you
you.
too. You too. All the very best.
All
Yeah.
right. Elise, do you happen to have a question? If you do, you can unmute and ask. And if not, that's okay. All right.
Okay.
We'll wrap up.
Thank you, Dr. Hedaya.
My pleasure.
Okay.
Bye.
Good night all.